DME suppliers like you know that managed care plays a huge part in your patients' lives. And that's why at Medtrade, there are going to be plenty of sessions to cover all of the aspects of what's ahead in the industry. Today, I'm joined with Laura Willard with AA Home Care to talk about some of the sessions that they have coming up and things that are going on with AA Home Care too. Laura, thanks so much for joining me today. Are you and the team getting ready for the show?
Hi, Christina. Thanks for having me today. And yes, we've been very busy planning for the newly combined Medtrade and our first time in Dallas, and excited for a new venue and really a new format from my perspective, and having everyone together under one building and one show and really getting the energy of the industry as a whole. So we've got a lot going on. It's going to be a great show, and AA Home Care is going to be there ready to meet and greet everyone that's coming.
Yes, and I know that AA Home Care, you have got a stacked day, especially on Wednesday, between the update, the state talks, which we'll probably cover a little bit more later, of course, Stand Up for Home Care, and then you've got some great sessions going on as well. David Chandler and Jeff Baird have the session on managed care, and that session is titled...
It's titled The Medicare Medicaid Managed Care Challenges and Opportunities. Looking forward to this session. I think it's definitely one of the highest priorities for our industry as a whole, working with those managed care plans. And trends have shifted from, traditional Medicare to the Medicare Advantage world, and the Medicaid plans have been taken over by Medicaid Managed Care. And so learning how to work with those plans is something key for our industry and key to the success for providers moving forward. So excited about this show and or this session, and what providers can have and take away from this to help their businesses.
Yes, and there's still time to get registered for the conference for those who may have not done that yet. So hopefully they'll be there to join you and David and Jeff. I know that that's going to be full of information. So what are you hearing from members? As obviously 2022 was such a big year, and now we're going into 2023. What are you hearing from your DMA members, but also members on the Hill as well?
Yeah, so we have a lot going on going into 2023. Obviously, we had some big wins with the rates and all last year with the end of year package bill from a federal level, and there's a lot going on from a state level as well. And one of the big things that we're hearing is, taking the wins we had at a federal level and really pushing those down to the states and the Medicaid programs. And so that's one of the biggest things I've heard from our members, is needing help and resources to help them work with these managed care plans, to help renegotiate those contracts, to actually help and go out and do some advocacy work to get rate increases for those Medicaid programs as well. And so that's one of the biggest priorities I've heard from just about everyone I've spoken with, everyone from a provider to the manufacturers as well. So I think that it's really top priority for everyone in our industry.
And so focusing on the states and getting involved in the state level is very critical right now. And I know that at the AA Home Care booth, you are going to have some opportunities to do that with the state straight talks sessions that'll be happening in your booth on Wednesday.
It is. It happens at 9 a.m. on Wednesday, and we've done this for several years now. And one of the big things I hear around Medtrade is, well, what's happening in California? What's going on in Florida? What are we doing in Wisconsin? And this is an opportunity to really showcase the work that our state associations are doing and that we're partnering with them on, and for providers to really learn how they can get involved and how that can help their business from an operational standpoint, profitability, and really get them involved in the advocacy effort. So excited to have that. We have most of the state association executive directors will be on site there and can meet with members in their states and help drive their membership and help drive some advocacy efforts at the state level. So it's a fun time. It's right behind the AA Home Care booth. We call it the State Association Lounge. And the AA Home Care booth is booth 407.
All right, so you heard it here. Booth 407 for those state straight talks. If you want to know when your state is going to be having their straight talk, check out the Medtrade website. All the times are listed there. Also, make sure you don't miss that the AA Home Care update is going to be later in the day on Wednesday. So that early morning start with the update not happening this year. you guys get a little bit of extra breathing room to do that later in the afternoon.
Yeah, absolutely. So excited to have Wednesday's really, like you said, the big day for AA Home Care with the State Straight Talk, with the AA Home Care Stand Up for Home Care on Wednesday night. And you still have time to get tickets for that as well. But the AA Home Care update is going to be a little bit different this year. We actually have some members of our executive committee that will be talking about what's happening in the DME industry and what are opportunities and potential challenges. So it's going to be a little bit different. We'll still have the staff of AA Home Care down there ready to answer questions that come up in the audience and all, but I think it's going to be a little bit of a refreshing session this year. So look forward to seeing everyone there.
Good. Well, yes, I think that everybody is definitely in for some surprises and a lot of learning at Medtrade. Laura, I'm going to let you get back to it because I know that you still got a lot to do before we head out to Dallas. So thank you so much for joining me today, and thank you so much for watching at home. If you still want to get registered for Medtrade, you can do that at medtrade.com. Laura, thank you so much. Have a good one.
Thank you.
All right, see you in Dallas.
All right, bye-bye.